Hello, I am a healthcare provider and I use this app called Historical Calendar. It's a free app that you can use to look at historical events as they occurred on the date of your access of the application. And so it gives you significance. And so a few days ago of this month in February, right, this is the date of recording, February 19th. And so I forget exactly when it was, but it was the week of Valentine's Day. I was looking at this event, and then I saw that the gentleman on the right, Ernie Schaff, has a boxing match with Primo Carnera. This takes it in the Northeast, I believe. Ernie Schaff is from New Jersey, and I think Primo is from New York City. So New York City versus New Jersey. Anyway, so we have this incident where these two boxers are competing, and so I've always been fascinated with anatomy and how things are represented in the body. So in this video, in this image, notice the positioning of Primo Carnera, right? He makes contact with Ernie's jaw. He definitely makes contact with the lateral or outer aspect of his chin, enough to the point that he's caused a deformation of the face. I would say his form is really good. Something to bring up now, which I'll tie into later. When we talk about self-defense, we have to consider that we have the reaction that we think we should do and the reaction that is appropriate to do. In this scenario, we have two people of a similar discipline engaging in a physical combat, right, match, where they understand the rules, they have technique, they have prowess, they have athleticism. Basically, for the most part, in all intents and purposes, they are the best pairing that can occur for this sport, right? They're both wearing the proper equipment. They're both dressed to the part. They've trained to a certain extent. They've probably studied their opponent. It's a good pairing in terms of the match. So what brought to my attention was the fact that there's impact to the jaw, and there's a very important nerve. It's called the trigeminal nerve. It's one of the largest, what we call the cranial nerves. The cranial nerves, there's 12 of them, 12 on the left, 12 on the right, 24 in total. So there's two pairs of 12, and they play a very unique role throughout your body. Because of the cranial nerves, the brain has the ability to understand the processes of the vital organs, what we call the vagus nerve. That's one of the cranial nerves. And then we have the ocular motor cranial nerve. That's a nerve that basically moves your eyes. You have these very small and very quick reacting muscles that allow you to move your eye in an insane speed and process information all at the same time. It's fascinating. The cranial nerves. One of the nerves controls your trapezius. So these cranial nerves, they basically are typically found inside the cranium, or they're connected to specific parts of your skull, components that and the two components that they fall into is that some are sensory, right? So they provide a sensory input to their respective area of responsibility, and some are motor, right? They just control function. Like, so the abducens muscle of the eyes is controlled by a cranial nerve, and that allows you to move your eyes from left to right. And then there's muscles that allow you to look up and down, right? And so together, those muscles, work together to allow you to make circular motions of your eyes. Anyway, not to focus on that. So, all right, so we have this match, and I say, notice the line of impact, right? This is the line of impact right there. So, we're gonna hit play, and so should I hit play? All right, so. Anyway, so Ernie, right? He is born on this day, September. So my assumption is that he sustained an injury to the trigeminal nerve, cranial nerve 5, the fifth of the 12 pair of cranial nerves. So he died on Valentine's Day. Okay, he was a professional boxer and a heavyweight contender in the 1930s, but he died after a bout. Okay, so we're gonna focus on the events. Here is some general info about the trigeminal nerve. So. Trigeminal nerve is also known as the fifth cranial nerve. Is a large three-part nerve in the head that sends signals from your brain to parts of your face and vice versa. You have two trigeminal nerves, right? One on each side of the face, so the left and right. They're one set of the 12 cranial pairs, 12 on the left, 12 on the right. The trigeminal nerve is responsible for sensation of the face. The trigeminal nerve provides sensation to the skin of the face as well as the mucous membranes of the mouth and nose. So when you smell things, when you taste things, the sensory input is the trigeminal nerve. That it includes touch, pain, and temperature and pressure. So if you drink something hot, something cold, something pricks you, that is the trigeminal nerve doing its job. Motor function. The trigeminal nerve also controls the muscles of mastication and chewing. And with this muscle and this nerve, it's called the masseter, that muscle. It allows us to speak, right? So if we didn't have the trigeminal nerve, we could not speak, as well as some other muscles in the head and neck. Trigeminal nerve has 3 main branches. That is ophthalmic nerve. So that's the one that provides sensation to the forehead, scalp, eyes, and upper eyelids. The maxillary nerve branch, this branch provides sensation to the cheeks and upper lip, and then I forget what the other one, but it will be covered, hopefully. So moving on, let's go fast forward. Okay, so here are the branches. So we have ophthalmic, trigeminal, maxillary, and mandibular. That is the third branch. Mandibular, that is motor. Okay, motor. So these two are typically sensory. The bottom one, that is motor. That allows you to move your masseter. So this right here is like the ganglion. That is the main ganglion of the trigeminal nerve, and then it has its three branches. This is the distribution of the trigeminal nerve. Okay, so okay, all right, fast forward. Okay, so my assumption is that there was damage to the nerve and also the capillary structures of the trigeminal nerve. What are capillary beds? Capillary beds, they're everywhere. That is where the exchange of oxygenated blood and deoxygenated blood occurs. So every cell in your body, bone cells, nerve cells, liver cells, every cell needs oxygen. And your heart, with great force and precision and rhythm, perfuses or pumps the entire body with oxygenated blood. And the capillary bed is so small that only one cell can pass through at a time in a single file. That's insane, right? So the oxygen cell, the blood cell, drops off the oxygen molecules and then becomes a deoxygenated blood cell. It goes into the venous system. So arteries are just tubes, right? And they rely on the pressure of the heart to pump blood through. Once they're out of those tubes, now they go into the venous system, which relies on valves, right? It relies on diffuse pressure, right? So imagine this, you're in a room and there's a door behind you. Now, the room can only fit 20 people. If 50 people come into this room, you are going to get pushed into the empty room. That is called diffuse pressure. So anyway, conditions caused by trauma to the trigeminal nerve. Neuralgia, that's chronic pain disorder that is intense facial pain. So with neuralgia, that is like an umbrella term. Whenever you have a sensation that results in some kind of discomfort, that is the origin path is a nerve issue, neuralgia. Neuropathic pain, TNF. Type of trigeminal neuropathy that results from injury to the trigeminal nerve. TMP can feel like a constant, dull, burning pain or sharp pain triggered by touch. Post-traumatic trigeminal neuropathic pain, PTMP, great acronym. A type of trigeminal neuropathy that occurs after traumatic injury to the face or mouth. So it could have been that one too. Cluster headaches. So, if you hit somebody there, they're bound to have cluster headaches on one side of the head, and at the same time of each day, irritation of the trigeminal nerve may play a role. So, a study can be. There's probably a study out there that focuses on the fact that boxers that maybe get hit on the same side of the face have reoccurring headaches on the same side. Lateral mandibular syndrome, Wallenberg syndrome, a condition that affects the function of the trigeminal nerve after a stroke or blood clot. Symptoms include difficulty swallowing, dizziness, and involuntary eye movements. Now, I did not dive deep into Ernie's biopsy for his death, or autopsy rather, but my assumption is due to the nature of the impact, right? Damage can be done to the capillary bed. These are very sensitive, small structures. Sidebar note, for every excess pound of additional fat that you hold, right, that is excess, that is an additional mile of capillary tubing, vascular tissue that the body has to develop and that the heart has to manage. So, has to manage, right? Because fat cells still require oxygen. If they don't get oxygen, they die, necrosis, they rot, and then an infection ensues. So I was about to jump into another topic, not going to because it's not appropriate. Anyway, So just know that, right? For every extra pound of fat, that is an extra mile that your heart has to perform. That is why people that have excess weight have high blood pressure, because everything needs oxygen or else it will die. So that's why it's laborious to do anything except just lay there. And in some cases, people that are overweight, just laying there is laborious. Okay, moving on. So where are we? We are, okay, so now we are here. So some info about Ernie Scharf. Main thing I wanted you to focus on is that an autopsy revealed that Ernie had died from cerebral hemorrhage, means bleeding. But he was also suffering from meningitis, that is inflammation of the meninges of the brain, which might have started, go back. Might have started at the previous summer as a result of the beating he took from the mesh. So moving forward, cause of death. Yeah, so then we just focus on that, so I could let it play, and now we're here. Okay, so glass jaw. Let's talk about glass jaw. People say like, oh, that man has a glass jaw. That is not such a thing. There is no such thing. So while the term glass jaw is a common expression, it doesn't have a precise medical definition. It is often used in boxing and other combat sports to describe a fighter who is perceived as having a weak chin or jaw, making them more susceptible to knockouts. There is no scientific evidence to support the existence of a quote-unquote glass jaw. The strength of the jawbone and its ability to withstand impact depends on several factors, including genetics, bone density, and the structure of the jaw muscles. However, some people may be more prone to jaw injuries than others due to certain conditions such as TMJ. So, go back. We're not ready for that. Okay, go back, pause. So, TMJ disorders. These disorders affect the jaw joint and can cause pain and instability, making the jaw more susceptible to injury. TMJ is basically, so it's the temporal mandibular joint. I want you to put your finger right. So go by your ear canal and then come forward and start moving your jaw. Where you feel that bump moving, that is your TMJ or temporal mandibular joint. Some people say TMJ joint, but when you say that, you're saying temporal mandibular joint. It's okay. Yeah, for those that don't know, it's fine. So osteoporosis. We're not going to go into that. That's a different. Previous jaw injuries. So if they've had a previous jaw injury, then more susceptible. Now I want you to focus on the fact that the first one, TMJ, that is a joint disorder, right? That is issue with the joint. So every articulating surface in your body has a synovial membrane. So you have a synovial membrane in your shoulder joint, your hip joint. Your TMJ has a synovial membrane. It has a capsule that allows for articulation in the mouth. If we didn't have this, we would create a lot of friction. Movement would be painful and impossible. Osteoporosis, of course, that is a weakening of the bone. There's osteopenia, which is reversible and a precursor to osteoporosis. Osteoporosis is not reversible and it is progressive. Previous jaw injuries. A previous jaw injury can weaken the jaw. Okay. It is important to remember that everyone's jaw is different, and there is no way to predict how well someone will be able to withstand a blow to the jaw. That's what it said there. Okay, moving forward. All right, we're at 13 minutes. My goodness. Okay, so all right, here we have the channel Self-Defense Goat. He is demonstrating the execution of elbow strikes, and I want you to focus on this one. Okay. This motion right here, what he did, bam, okay? As you notice, he's involving his torso. His hips move with his arms, okay? These strikes are okay, these up strikes, right? But that's gonna hit the jaw bone, like the basically the front of the bottom and front of the chin. It's not gonna do a lot. It might knock the head back, but it's gonna cause discomfort, but we're not in the park of disabling somebody. So, but yes, this, right? This is what is effective. And here's where we're gonna go over it. So we have two Muay Thai fighters. I've slowed down the video. All right, so first he makes contact with a kick. Notice he hits him in the face. I think that was a kick or was that a punch? Let's find out. Let's go back. So the leg comes up. It's not clear, but he does get hit like right there. So yeah, okay, let's follow him. Okay, so basically he has the upper hand. He's in retreat, okay? Now, punch in the head, okay? The rope obscures the line of sight. Connect right there. That's what happened. We're gonna watch it again. Well, and I'll let this play a few more times. So again, they fight, they hit the face, and boom, jaw. See how quick that was? Let's go back and watch it slow, okay? So, connects with the head, right? So nothing, he does not go down. He connects with the head again, right? The rope obscures the line of sight. Connect, right? Now, right here, right, let me go back because it's very important that you guys see this. So it happens so fast. It happens so fast. And as you look, he did not generate a lot of force. Bam, right there. One more time for the people in the back. Right there. Right there. That's all it took. He's not a man of I mean, I'm not saying he's not a man of substantial physique, right? Let's play it again regular so you guys can see it. He's not a man of like, he's not a big guy, right? And neither is the other guy. Now, I don't care how big you are. I don't care how much you weigh and lift. If you get an impact to the trigeminal nerve, which is a nerve that originates from what's called the pons. The pons is in your brainstem. The brainstem, one of its responsibilities is motor control, right? Motor control, motor planning. Let me just confirm that. Brainstem roll. Brainstem roll. Yeah, so it's a control hub. It controls, it acts as a vital bridge connecting your brain to the spinal cord. All information traveling between your brain and the rest of your body passes to the brainstem. Essential functions of the brainstem: breathing, heart rate, blood pressure, sleep and wake cycles, swallowing, balance, and coordination. It's also the reflex center. It's responsible for coughing and sneezing, gag reflex, pupillary reflex, so adjust to light. That's the whole thing. Vestibular ocular reflex, stabilization during head movements. Now, so anyone that has vertigo has vestibular issues. So we have three systems of balance. This is all connected. Visual system is the system balance that allows you to understand where you are in relation to space. Okay, so where am I? Am I in a room that's level? Yes. Your vestibular system communicates in relation to head movement, in relation to position, speed. Right? You can close your eyes and you know that you're shaking your head, you're lifting your head. Right? And then you have what's called your somatosensory system, or joint proprioception. There are so many nerves in your feet that communicate. Just think about the time that you stepped in dog poop. If you've been that unlucky, I don't care what you're wearing. You just know that you stepped in some dog waste. It's infuriating. Anyway, or you can tell the difference between walking on a hard surface into a carpet or more. So anyway, so just consider that. So the trigeminal nerve comes from the pons. It comes from the brain stem. So when you strike the trigeminal nerve, okay, and we're gonna go back to where we see it, okay, right here. When you strike the trigeminal nerve, which comes out of this right there, trigeminal nerve. All right, so I definitely want to stay at 20 minutes. Hopefully this is engaging and informative. This app is called Complete Anatomy. I do not recommend you guys getting it. Please, like the information. So this is because I'm a practitioner and I am fascinated by the body and I want to learn more. No, I do not want to restore recession. So here we have the nervous system, right? This is an anatomical view of a skeleton. And here we have, to our understanding, the entirety of the nervous system. And so as I zoom in right here, so not necessarily this line right here, not this, okay? This is the branch, the mandibular branch of the trigeminal nerve. Let's look at it. So trigeminal, not trug, trigeminal. Trigeminal nerve left. Okay, I want to isolate it. So this is the trigeminal nerve. Look at that thing. Okay, this right here is where it goes into the brainstem, right? This portion right here. Okay, we have the, remember we have ophthalmic, maxillary, and then mandibular, right? So let's do some information on the trigeminal nerve, okay? Right, fade others so that we can see that it basically, it's, for some reason, right? And like, it doesn't really make sense. Why are we designed so that we have this protrusion of a very, very important nerve that connects to the base of our brain that is responsible for a myriad of important functions? It just protrudes right here. Why is that? I don't know. We can have a discussion about it later. So origin path, highlight path. So look at that. It's there. Isolate origin path. So, where it's exposed, right? And yeah, models, let's look at that. Yeah, we don't need to do that. We're getting too deep. Okay, so let's do some info. Where's my info? Here we are. Info. Hello. So, of course, runs anterolaterally from the pons over the anterior part of the petrous ridge and the temporal bone to the trigeminal cave, where the trigeminal ganglion is located. That's that big branch. Alternate, maxillary, and mandibular, right? These are branches and V's. V1, V2, V3. V3 is the one that we're focused on striking. Now, I want you to think back to that video. So what's important is that, and I'm hoping that the person that initiated this conversation can demonstrate what I mean. When you are in a position where you have to defend yourself, what you need to understand is that a punch is a very telegraphed movement, right? Unless you are trained in how to punch properly, you are not going to create a lot of damage and impact necessary to defend yourself and remove yourself from the dangerous situation. Wing Chun is a great martial arts to look into. I believe there are some Wing Chun schools in the area, or the area that you are, you should look. Wing Chun was designed with women in mind to have precise flowing strikes to key areas of the body to disable somebody. So anyway, originates from the pons, right? Roughly where the middle cerebral pedicle enters the brainstem, motor axons, trigeminal nerve, blah, blah, blah. So sensory, course, branches, applied structures, maxillary, mandibular. Nerve travels into the infratemporal fossa. So when you ever see fossa, that means the hole. And that is the hole that I showed you guys earlier. And innervates the skin of the lower face, from the lower lips down to the lower margins to the mandible. Its territory arcs posteriorly and upward just anterior to the ear. Other tissues innervated by the sensory fibers and mandibular nerve include the mucous membranes, lining of the cheek, mandibular gingiva, mandibular teeth, and the anterior 2/3 of the tongue. The motor fibers of the mandibular nerve innervate the muscles of mastication, including the temporalis, the masseter. That's the main one. We chew that. The medial pterygoid and the lateral pterygoid. Those are the muscles that allow you to shift your jaw from side to side or protrude your jaw. Don't do a lot of that, please. Tensor tympani, mylohyoid, and the posterior digit. The mylohyoid, don't worry about that. Don't worry about that guy. So, although not fibers of the trigeminal nerve, many sympathetic and parasympathetic fibers will travel to their targets by joining the trigeminal nerve. Chiefly among these are the parasympathetic fibers. Anyway, so understand that what you want to do, right, is if they come with a punch, mainly from the side, right? They come with a punch from the side, so if someone is punching directly at you, that is an experienced boxer, okay? And typically you would hope that people that have experience in martial arts or combative sports, try not to use them, right? Because there is a repercussion and a consequence to having ability and skill to inflict harm with technicality and precision, right? So I was in the military, and so we learned a form of mixed martial arts, and we were told we are not to engage in conflict physically with civilians because there's liability, right? Because if we use our training and we cause harm or death at worst, there is no sympathy, or we will throw the book at you, right? Because you should be composed, you're held to a higher standard, and you have responsibility with the information that you have. And so my intent with the population and the audience that is watching this video at this time is to understand that right here, okay, I want you to look at the face, okay, and understand that basically if you aim at the jaw, right, and what a good landmark to understand is, though, the eye is here, the trigeminal nerve is there. There it is, right there. It's so that's the amazing thing about anatomy is that where my heart is where your heart is, where my liver is where your liver is, unless you have what's called situs inversus. Don't Google that. That is a very small percentage of people that have that condition. It's very rare. So there are a lot of things that divide us, right, in the world, in our country, right? So but ultimately we share the design of our body, but just know there are key points. So this is not a good place to strike because we have a lot of fat pads, right? Or just cushioning, right? And also striking here means that, you have to punch most likely. And then, so let's go over the self-defense portion of it. So a person does a telegraph punch, meaning they're swinging from the outside laterally, right? And they're coming in, right? That's an inexperienced punch, right? People know that they want to hit with the punch, but they don't know where to hit sometimes. So if you aim for their jaw, that is within the peripheral view of the eyes. All right, and the eyes communicate in real time, very fast to the brain, what is occurring. In that moment, someone's reflexes are definitely heightened. So the likelihood of you returning a accurate punch, right? Chances are slim. What you want to do is step into their punch, right, to close the distance and not allow for them to gain momentum. You can block or quickly take your olecranon or your elbow and land a very precise strike to this area, and they will go down. So this is not what I watch. I don't watch fights. Obviously you search this and this comes up. Anyway, so here's BJ Penn's fight. Let me lower the volume so that I don't have conflicting audio. So, all right, so 35-second video. I'm gonna play it and then break it down. So, all right, so BJ Penn is the guy with the shirt. The guy without the shirt is not BJ Penn. So, all right, so there's stuff going on here. I'm pausing it right there because I need you guys to see something. So BJ Penn, I guess in this moment he realizes like, hey, this is not a fighting guy. Maybe he was trying to be like, de-escalating. And so anyway, so let's see if we can play this at half speed. Playback speed. Let's go to what? Let's do that. Okay. All right. So, all right, moving forward. I want it a little bit slower because I need you guys to see something. So let's do that. Okay. So play. Okay. Punch right there. That's where it occurs. So let's look at it again. Right? Oh my God, I know. Okay. So he punches him in the side of the head, nothing happens. Nothing happened. Right there. Trigeminal nerve. All day. That's all it took. That's not a skilled individual. And he didn't even swing that hard. If I play it back in real speed, you'll see. He didn't even swing that hard. So here it goes again. Observe. Yeah, that's not a haymaker, right? So just imagine performing. So let's see here. Elbow strike to the chin, self-defense.
Elbow strike to the chin, self-defense.
Yeah. So look. This is what comes up. Okay. So let's see if this is what this guy says.
Elbows are a great thing to utilize in a fight, and it can be anything from the cage. He's gonna look for that elbow to the
Trigeminal
ring,
nerve. Trigeminal nerve.
or even the street.
Trigeminal nerve.
So here are 5 different elbow strikes that you should start incorporating into your training. Number 1, the horizontal elbow.
This one.
Essentially striking with the upper forearm, and we're just going in a horizontal motion across the
Yep,
face.
right
Number
there.
2, the downward elbow. Essentially hitting in the same
Okay.
exact
Let's go back. Right. Look at his angle.
downward elbow. Essentially hitting in the same exact spot as we would the horizontal, only this time we're coming down at an angle.
Okay, don't do that one. Don't do that one. He's not this. Don't do that one.
Striking with the upper forearm, and we're just going in a horizontal motion.
Look at his line.
Across the-
Where does he end up? If you go about shoulder level, you will connect with the jaw, right? And you will impact the trigeminal nerve, and they're going down.
face. Number 2, the downward elbow. Essentially hitting in the same exact
This
spot as
requires
we would
more
the
skill.
horizontal, only this time we're coming down at an
My
angle.
concern with
3,
this one
the
is that
uppercut.
you
Once
know,
again,
so
striking with the same part.
yeah.
But
My concern with the downward elbow is that the angle of impact and stress to the joint, you could do something to the joint, right? When you come across horizontal, you have more stability and more security with significant muscles in that area. Okay.
I'm doing it in an uppercut motion. Number 4, the tomahawk elbow. I'm going to
Yeah,
be
don't do
hitting
that.
just before the
Don't.
tricep.
Anyway, focus on this one. Don't do the tomahawk. Don't make it. Keep it simple. Okay. The simple motion is.
Street.
Can I please? Can I slow this down?
So here are 5 different elbow strikes that you should
One more
start
time.
incorporating into your training. Number 1, the horizontal elbow. I'm essentially striking with the upper forearm, and we're just going in a horizontal motion across.
This is all you need. Horizontal elbow. That's it. All right. Godspeed. God bless. Take care. Be safe. And look into self-defense. Take care.